Illness is neither an indulgence for which people have to pay, nor an offence for which they should be penalised. The words of Nye Bevan, founder of the National Health Service, quoted earlier today by Keir Starmer, the Labour leader. The NHS is a subject about which almost all of us have stories, and most of us feel, in one way or another, emotional. NHS funding and reform is not just another political story. Make promises about our NHS, and you had better deliver them. In his speech today, Sir Keir made some dramatic promises.
Ambulances, 7 minutes for cardiac arrest. A&E back to the 4-hour target. GPs, the highest satisfaction levels on record. Waiting lists down. Planned treatment within 18 weeks. No backsliding, no excuses. We will meet these standards again. We will get the NHS back on its feet.
And on all of that, I say absolutely wonderful. Great. And if that requires further tough reforms inside the NHS, that is a price which must be paid. But these are huge, ambitious promises meant to be delivered in the first term of a new government, and that is really quick. I have no questions about the what or the why, but there are certainly questions about the how. And remember, finally, we are living at a time of huge, weary cynicism about politics and whether the state can actually deliver anything well. So if Labour came into power and then failed on its NHS promises, we would see a further and perhaps catastrophic decline in trust. This is a very, very ambitious programme, isn't it?
It is, very much so, and unapologetically so, because the depth of the crisis in the NHS is so great that even, and I'm struck by, you're right to say it's ambitious, what we've committed to in the first term is meeting basic waiting time standards. Things like waiting 4 hours in A&E, an ambulance arriving in time for a heart attack or stroke, or if you have those symptoms. It's extraordinary that after 13 years of Conservative government, achieving the minimum is seen as ambitious. It is. We know we can do it, and we're assured, we've been doing, before we made these bold pledges, we've done a lot of work, talked to lots of experts in and around health and social care to understand what we would need to do. We know we can do it, but it is going to be tough, and we make no apology for being ambitious.
Have you properly costed them? Because if you talk, for instance, about ambulance waiting times, then the ambulance workers, like the nurses, are engaged in industrial action for higher wages. You're not going to be able to get those waiting times down without sorting out the wage bill, which is going to be very expensive. So I ask again, have you costed it all?
Yes, but the point that Keir's made today, and I think this is a really important argument for Labour to be out there making, is, of course, investment matters, and the last Labour government showed us that, but so does reform. And we've deliberately gone out there making the strong case for reform first and foremost, because I think people almost expect a Labour government to invest. What they want to know, are we serious about modernising and changing? And frankly, we have got to be honest about the fact, and this is where these 5 missions Keir's talking about are so important. There are lots of other things that we would like to do, but we're not going to do.
You're going to focus on these.
And we are
I absolutely get it, but I'm sorry. I come back to my example, just plucked out of the air, of the ambulance service. Because, you can talk about reform and you can talk about structures, but if you don't pay ambulance staff enough to get them back into the ambulances, and if you don't hire enough ambulance staff and have enough ambulances in the fleet, you won't get waiting times down, however much reform or non-reform you do.
True, but we also need to look at where the money goes that we're already pouring into the NHS, and the truth is, it's not spent very efficiently in lots of cases. So, for example, because people can't get access to the front door of the NHS in primary care and general practice, they end up going to A&E, which is worse for them, but also more expensive for the taxpayer because it costs 40 quid to see a GP, 360 quid to turn up in A&E. So we're looking at how we also shift funding throughout the system to get the most bang for the buck.
I completely understand that and agree with it. But to get better primary care, to get those hubs with doctors and nurses and physios and all the rest of it around the country is going to cost money. None of this comes cheap.
We've committed to the biggest expansion of NHS staff in history, 1.6 billion funded by the non-dom tax status, and also community mental health hubs, 8,500 extra workers, also supporting every school, funded by closing a tax loophole that's enjoyed by private equity fund managers. That would be transformational if we could deliver that, if we're given permission to deliver that by the voters, because as well as being a new service, it would reduce pressure on other services, freeing up GP appointments for other people, reducing people going through the front door of A&E, actually reducing demand on the police as well, because every time I've been in A&E since January, I've seen at least one, sometimes as many as 4 uniformed police officers, and every time they're dealing with someone who's had a mental health crisis. So if we can get there a lot earlier with support in the community, better for the patient, more effective for the taxpayer.
These were very, very clear, absolute hard promises by Keir today. No backsliding, no excuses.
Yep.
And that says to me that if you are in danger of not meeting those promises, you have to find more money.
Oh, it's going to be my neck on the line.
If it's with your neck on the line, but if it's a choice between, having to raise taxes or having to borrow a bit more money or missing those promises, there is now no choice. He has to deliver those promises, which means that he has to find the money if it comes to that.
Keir's gone into this with his eyes wide open, and I think the Labour Party is waking up to the fact that in setting out these 5 missions, he has established the priorities for the next Labour government. And there are going to be other good Labour things that we might want to do.
Give me an example.
Won't be able to afford to do.
Give me an example.
For example, I don't like the tuition fee system the way that it is. Keir Starmer doesn't like the system the way that it is. And we've been honest about the fact that, yes, we want to reform and do things differently, but what we wouldn't be able to do is afford to provide universal access to higher education completely free.
You'd like to, but you can't.
Absolutely. And so there are lots of things that we would like to do that we won't be able to afford to. And your challenge about the cynicism is the right one. And that's why, sometimes we go on programmes and they say, well, will you commit to this? Will you commit to that? And the answer is no. And it's not because we're hostile to these ideas. It's because we've been here before as a Labour Party, 4 election defeats in a row. And in every single one, there was always a question about, will you be able to afford your promises? And we're not going back there again, which is why we're being so ruthless about the priorities we've chosen.
I mentioned the terrible lack of care in mental health and the real problem with suicide, which is a ghastly, ghastly problem hanging over this country. Keir said he's going to get the number of suicides down. My question to you is, how?
I think a number of ways. I mentioned the community mental health hubs and the support in every school. That's really important for 2 reasons. One, we know that we've got a crisis amongst young people.
Why do you think so many young people are killing themselves? What do you think's behind this?
I think this is a generation of young people who are going through pressures that my generation, I'm 40, my generation didn't have to go through this. In terms
economic, housing, social media.
Yeah, well, I mean, social media is a big part. And like with things like bullying, for example, in schools, when I was at school and there was bullying, you could go home and leave it behind at the end of the day. Now the bullying follows you home on your phone. I think kids are bombarded with messages and an idealised version of life on platforms like Instagram, which are unreal. They are a presentation of perfection that people cannot measure up to. I think there is a generation that's really struggling post-pandemic. And I feel this viscerally as a politician. We supported a whole number of the lockdown measures because we knew it was in the national interest and things would have been much worse if we didn't. But there's been a long tail of that in terms of the impact on the education and health and well-being of young people. And that's a debt that we owe these kids as a society, and the government isn't paying it. And that's why we're prioritising young people's mental health. I was astonished to find that suicide is the biggest killer of young people.
Do you accept that if you win office and you have a majority Labour government and you do not tick off one by one those promises that Keir Starmer made today, it will be a disaster for the Labour Party?
I think people desperately need this change. I believe we can deliver it. And I'd say to people out there who are cynical... So what does it do to you if you don't do it? Well, I think I'll be out on my ear. And, who cares? The most important thing is that we deliver for the country. Yeah. And I just say to people, I understand the cynicism that's out there about politics and politicians. I really do. It's like having a stake through the heart hearing some of the criticism, but I understand it. You can kick us out after a term if you don't see the country improving. If we don't do what we say, you can kick us out, but give change a chance, because goodness me, things could be better than this.
And more than all of that, if you are Health Secretary under Keir Starmer's Labour government and you don't deliver these things, would you resign?
I haven't got the job yet.
I know.
Look, I know how important it is.
Yeah, I know how
important it is to deliver, and if I don't deliver, I would not expect to remain as Health Secretary.